The U.S. Surgeon General says the skyrocketing use of e-cigarettes among young people is a major public health concern. Surgeon General Vivek Murthy is calling for action to reduce the use of e-cigarettes and keep the products out of the hands of young people, even though he admits more research needs to be done on its potential harms. To take a closer look at what this could mean for the industry, we're joined live on the KCBS Ring Central Newsline by Unica Lee, a research public health analyst with RTI International. Thank you for joining us this morning. When it comes to telling people that this is a big health problem, is it mainly the nicotine or is it all e-cigarette products?
Well, I think that when it comes to youth and young adult use especially, nicotine is one of the biggest issues that comes to mind, in part because we know that using nicotine during a developmental period can affect the brain development negatively. So that's certainly one of the things that really comes to the forefront when you're talking about protecting the health of youth. There's some testing showing that there are other things in e-liquids or in the aerosols that come out of e-liquids that can be concerning as well. But further study should be done to better understand that, but they certainly don't contain a harmless water vapor, which is a popular misconception.
You know, we have this in the United States. In Great Britain, the Public Health Service essentially has put a stamp of approval on e-cigarettes, at least in terms of viewing them in comparison with smoking itself. So there's still some confusion here.
Yes, I think there's a lot of debate about how harmful e-cigarettes could be on a population level, and you do see some vigorous debate around that. Although we don't really know a whole lot about how well e-cigarettes might work in terms of, say, reducing or helping people quit cigarettes or other tobacco products, there's a lot of conflicting evidence and some evidence suggesting that e-cigarettes may not help and potentially could help maintain the nicotine addiction. So I think there is more debate to be had before we understand that issue.
How big of an issue or problem is it that some e-cigarette products are targeted toward young people?
I think it's a pretty big problem, in part because of the issues and risks that I was just mentioning related to exposing young people to nicotine at a time where their brains might be developing and more vulnerable to the harms associated with nicotine. Also, what we're finding is that a lot of marketing around e-cigarettes is using many of the same media channels and approaches that have been used with cigarettes and other tobacco products in the past. So that's definitely concerning to those in the public health community.
We know already, of course, that the federal government has some regulatory control, for example, regulations that ban the sale to anyone under age 18. How much farther do you think the government will go or should go?
I'm really not sure, and I couldn't necessarily speculate on what will be done, but you're right. FDA currently has regulatory authority over the manufacturing, marketing, and distribution of e-cigarettes, and will definitely play an important role going forward.
Unica Lee, thank you for joining us this morning. Ms. Lee, a research public health analyst with RTI International, as the U.S. Surgeon General says the skyrocketing use of e-cigarettes among young people is a major public health issue.